When your blood sugar levels are higher than normal but not quite high enough for a diabetes diagnosis, this is referred to as prediabetes. Unfortunately, more than 80 million people in the United States fall into this category without even realizing it. And if they don't seek treatment or make substantial lifestyle changes, prediabetes can lead to type 2 diabetes. The tricky part? It can sneak up on you with little to no noticeable symptoms. That's why it's crucial to recognize the subtle signs early on. Imagine it as a silent alarm, quietly alerting you that your blood sugar levels are higher than they should be, but not quite high enough to be classified as diabetes. It's like a yellow traffic light, urging you to slow down and take immediate action to prevent the oncoming danger of diabetes. So, are you ready to uncover the truth and take control of your health? Stay tuned as we delve into 7 hidden symptoms of prediabetes you must avoid. The first symptom on our list is increased thirst. Now, you might wonder, how does thirst have anything to do with prediabetes? Well, let's dive into the science behind it. When your body has more glucose than it needs, your kidneys spring into action to flush out the excess. But here's the catch. To do this, your kidneys need to produce more urine, which in turn uses up more of your body's water reserves. This process can leave you feeling parched, even if you've been drinking what you would consider a normal amount of water. So, how can you recognize this symptom? It's not about the occasional thirst that comes with a hot day or after a workout. We're talking about a persistent, unusual thirst that doesn't seem to be quenched no matter how much you drink. You might find yourself waking up in the middle of the night, mouth dry as a desert, reaching for a glass of water. Now, before you panic and rush off to get a diabetes test, let's talk about how to manage this symptom. First off, it's important to understand that increased thirst can be caused by a variety of factors, not just prediabetes. It could be due to the weather, your diet, or even certain medications you're taking. If you notice a sudden change in your thirst levels, it's a good idea to keep a hydration diary for a week or two. Note down how much you're drinking each day, and if it's significantly more than the recommended 8 glasses a day, it might be worth discussing with your doctor. Remember, it's not just about how much you're drinking, but also how you're feeling. If you're constantly thirsty and it's accompanied by other symptoms such as frequent urination, fatigue, or unexplained weight loss, it could be a sign of something more serious. So, if you're reaching for the water bottle more often, it might be time to get checked. Don't ignore your body's signals. It's always better to catch prediabetes early, because with the right lifestyle changes, you can prevent it from progressing to full-blown diabetes. Next on the list is frequent urination. Frequent urination is another hidden symptom of prediabetes that often goes unnoticed or dismissed as a natural response to increased fluid intake. However, it's essential to understand that if you're frequently visiting the bathroom, especially at night, it could be your body's way of signaling an underlying issue. Prediabetes is a condition where your blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. But why would this lead to frequent urination, you may wonder? Well, when there's excess sugar in your bloodstream, your kidneys work overtime to filter and absorb it. But if they can't keep up, the excess sugar is expelled from your body through urine, hence the frequent trips to the bathroom. So how can you recognize this symptom? It's not as straightforward as counting the number of times you visit the bathroom. You'll need to be mindful of any changes in your usual routine. Maybe you're waking up multiple times at night to urinate, or perhaps you're noticing that you're going more frequently during the day. It's these small changes that you need to keep an eye out for. Now, if you've noticed a change in your urination pattern, don't panic. The first step is speaking to a healthcare professional. They'll likely conduct a simple blood test to check your blood sugar levels and determine if prediabetes might be the cause. If it turns out that you do have prediabetes, there are ways to manage it. Making lifestyle changes such as eating a balanced diet, maintaining a healthy weight, and incorporating regular physical activity into your routine can help regulate your blood sugar levels and reduce the frequency of urination. Also, remember to stay hydrated. While it might seem counterintuitive to drink more water when you're already urinating frequently, dehydration can actually cause your body to produce more urine. So, it's important to keep your fluid intake up. Remember, a trip to the bathroom too many could be a sign. Don't ignore this potential warning sign of prediabetes. Awareness and early intervention are key to managing this condition effectively. Feeling tired often. Fatigue is our third symptom. Now, we're not talking about the occasional yawn or needing an extra cup of coffee in the morning. We're referring to a constant sense of weariness, A persistent feeling of exhaustion that doesn't seem to let up even with ample rest. This kind of fatigue can be a telltale sign of prediabetes. But how exactly does prediabetes lead to such draining fatigue? Well, when you have prediabetes, your body struggles to use glucose properly. This sugar is the primary source of energy for your cells. So when it's not efficiently used, you can feel persistently tired. The troubling part is that fatigue is a common symptom for many conditions, which is why it can often be overlooked or shrugged off as just a side effect of a busy lifestyle. But it's essential to pay attention to this kind of constant exhaustion, especially if it's accompanied by other symptoms we're discussing in this series. So, how can you recognize fatigue as a potential symptom of prediabetes? It's important to note that we're not talking about feeling tired after a long day of work or a strenuous workout. Prediabetes-related fatigue is feeling tired and low on energy most of the time, even when you've had plenty of sleep. It's a kind of tiredness that interferes with your daily activities and overall quality of life. If you find yourself experiencing this kind of fatigue, it would be a good idea to get checked for prediabetes. But don't wait for the doctor's appointment to start making changes. Simple lifestyle modifications can help manage this fatigue. Regular exercise can improve your body's insulin sensitivity, helping your cells use glucose more efficiently. A balanced diet, rich in whole grains, lean proteins, fruits and vegetables, can provide sustained energy. And of course, ensuring you're getting enough quality sleep is crucial. Remember, fatigue isn't just about being tired. It's about feeling drained and low on energy more often than not. It's a signal from your body that something isn't quite right. If you're constantly feeling drained, don't ignore it. Fourth on our list is blurred vision. This symptom may seem somewhat out of place, but it's actually a common indicator of prediabetes. You see, when blood sugar levels rise, they can cause the lens in your eye to swell, changing your ability to see. This alteration in your vision can be quite subtle, or it might be more pronounced, making it difficult to focus on objects, particularly those at a distance. Recognizing blurred vision can be tricky. It's not like you wake up one day and the world is out of focus. More often, it's a gradual change, and you might only notice it when your daily activities start to be affected. Maybe you're squinting to read the newspaper, or road signs are becoming harder to decipher. It might just seem like a normal part of aging or that you need a new glasses prescription, but it could also be a sign of prediabetes. Now, it's important to remember that not everyone with prediabetes will experience blurred vision. It's just one of the potential symptoms that might show up. If you're experiencing blurred vision, along with other symptoms we've discussed, like increased thirst or frequent urination, it's definitely time to pay a visit to your doctor. So what can you do to manage blurred vision if you're pre-diabetic? First, it's crucial to maintain a healthy lifestyle. Regular exercise and a balanced diet can help keep your blood sugar levels in check. It's also a good idea to have regular eye exams. These checkups can spot any changes in your vision and also detect other eye conditions that can occur with diabetes, like cataracts or glaucoma. In conclusion, blurred vision can be a subtle yet significant sign of prediabetes. It's not something to be ignored, and it's essential to seek medical advice if you notice any changes in your vision. After all, our eyes are not just the windows to our souls, but also to our health. If things are getting a little foggy, it might not be your glasses. Our fifth symptom is slow healing. There's a fascinating process that our bodies undergo. When we get a cut or a bruise, our body instantly sets to work. Blood clots form, preventing further bleeding. White blood cells rush in to fend off any potential infections. Then begins the healing process, gradually knitting together the damaged tissue. Under normal circumstances, this is like clockwork. But what if the clock seems to be slowing down? What if that scrape from a week ago is still fresh, or that bruise from 2 weeks ago is still as vivid as ever? This could be a sign of prediabetes, a condition where your blood sugar levels are higher than normal, but not high enough to be classified as diabetes. Prediabetes can affect your body's ability to heal itself. A surplus of sugar in the blood can cause inflammation and damage blood vessels, hampering the delivery of essential nutrients to the injury site. This slows down the healing process and in some cases may even lead to infections. So, how can you recognize the symptom? It's all about being mindful of your body and its healing patterns. If you notice that your cuts, scrapes, or bruises are taking an unusually long time to heal, it's time to pay attention. You might be wondering, what can I do if I notice my wounds are healing slowly? The first step is to consult with a healthcare professional. They'll likely recommend a blood sugar test to diagnose prediabetes. If confirmed, they can guide you on the best course of action, typically involving changes to diet, exercise, and potentially medication. But let's not forget, prevention is better than cure. A balanced diet, regular physical activity, and maintaining a healthy weight are key to keeping your blood sugar levels in check. These healthy habits not only prevent the onset of prediabetes, but also ensure your body's healing process is functioning at its best. Take note if your cuts and bruises are taking longer to heal. It's not just about the discomfort or the appearance, it could be a sign of something deeper, a sign that your body is trying to tell you something. Listen to it. Sixth on our list is tingling or numbness. This symptom, often referred to as neuropathy, is a common sign that you may be dealing with prediabetes. Neuropathy is a condition that affects your nerves, particularly those in your extremities like your hands and feet. It can manifest as a sensation of pins and needles, a feeling of wearing an invisible glove or sock, or even complete numbness. When your body's blood sugar levels are consistently high, it can lead to a gradual damage of the nerves. This happens because the excess sugar interferes with the nerve's ability to transmit signals. Moreover, the high blood sugar also weakens the walls of the small blood vessels or capillaries that supply the nerves with oxygen and nutrients. As a result, the nerves in your extremities, where the capillaries are most delicate, may become damaged, leading to this tingling or numbness. Recognizing the symptom can be a bit tricky. Many people dismiss it as a temporary discomfort or attribute it to their foot or hand falling asleep. But when the tingling or numbness is persistent, it's not something to be ignored. It's especially important to take note if the sensation is not associated with a specific position or activity that might cause your limb to fall asleep. If you're experiencing this symptom, it is crucial to consult a healthcare professional. They may recommend lifestyle changes or medications to help manage your blood sugar levels and slow the progression of neuropathy. Regular exercise, a balanced diet, and maintaining a healthy weight are all key parts of managing prediabetes and its symptoms. Additionally, taking care of your feet can help prevent further complications. This includes keeping your feet clean and dry, wearing comfortable and supportive shoes, and examining your feet daily for any cuts, blisters, or other abnormalities. So, the next time you feel that persistent tingling or numbness in your hands or feet, don't just shake it off. Those tingling sensations might be more than just a foot falling asleep. Finally, our seventh symptom is dark skin patches. This symptom is often overlooked, but it's a key sign of prediabetes. These patches typically appear in areas where the skin folds or creases, like the neck, armpits, or groin. They are darker than the surrounding skin, have a velvety texture, and are known medically as acanthosis nigricans. This condition is a result of insulin resistance, a hallmark of prediabetes. Insulin resistance causes an overproduction of skin cells, leading to these dark, thick patches. Essentially, your skin is trying to tell you that your body isn't using insulin effectively. If you notice such patches on your skin, don't panic. It's an early warning sign, and there's still time to take action. Lifestyle changes like a healthy diet and regular exercise can help restore your body's insulin sensitivity. Medication may also be an option, but it's always best to consult with your healthcare provider first. Those dark patches on your skin might be a sign of prediabetes. So there you have it, 7 hidden symptoms of prediabetes. We've delved into the common yet often overlooked signs, from the subtle increase in thirst and frequent urination, to the more pronounced fatigue and blurred vision. We've also shed light on slow healing, tingling or numbness, and the appearance of dark skin patches. Each of these symptoms is a potential red flag, signaling that your body's insulin function may be compromised. It's crucial to be aware of these signs, as they offer an early warning system for prediabetes, which, when left unchecked, can progress into type 2 diabetes. Regular health checkups, coupled with a vigilant eye on these symptoms, can help in the early detection and prevention of this condition. Remember, a proactive approach to your health can make all the difference. Remember, early detection is key. Stay healthy and keep an eye out for these signs.